Hello and welcome to this screencast. My name is Thomas Gray. I'm a Clinical Leadership and Education Fellow at Sheffield Teaching Hospitals NHS Foundation Trust. I'm also a Registrar in Obstetrics and Gynecology. The purpose of this short screencast is to talk to you about Healthcare Supervision Logbook, which is a new smartphone app which has been developed at Sheffield Teaching Hospitals by myself and Professor Tom Farrell. I'm going to show you some pictures of the screen from the app and tell you about how it works and what the four main functions are of the app. So the app is secure. You need a username and a PIN number to access it, and this can be set up when you're a new user using the system. From the first time you log into the app, you then just have to type in a 4-digit PIN number in order to get access. So it's completely secure. This is what it looks like when you're turning it on, and this is what the home screen of the app looks like. So there are simply four menu items in the app: logbook, sessions, training and patients. And there are two different versions of the app. There's a version for trainers and there's a version for trainees. So a trainer would be somebody who is supervising a trainee, so typically a consultant, and a trainee would obviously be a doctor in training. The four items in the menu for the trainers are logbook, training, patient and the sessions, as you can see on the screen here. And then for the trainee, they don't have this training section, they just have logbook, sessions and the patient section. So I'm going to talk to you first of all about the sessions section of the app. So the sessions section of the app is used by both trainees and by trainers, but it has a slightly different function for each one. So trainees, so doctors in training, use the sessions part of the Healthcare Supervision Logbook to provide feedback on their perceived value of the educational content of a session, including their perceived value of the educational and clinical supervision they've received. So every time they do a clinical session, and by that I mean a clinic, a theatre, an on-call or a teaching session, they would basically fill in a feedback form about that session. And that will include things like the timing of the session, so did the session start on time and end on time? The details of the session, so for example if it's a clinic, the number of new patients they've seen, the number of follow-up patients they've seen. If it's a theatre session, the number of major cases, the number of minor cases, whether there was opportunity to review the patients post-operatively. And there's also a question about whether they received any feedback during the session, about whether they were offered work-based assessments during the session, and also a question about whether they were undermined during the session. And I'll show you something more of that in a minute. Currently this is anonymised for the trainer, so when the trainee fills this feedback form in, they currently select anonymous instead of selecting the name of a trainer, but it is possible to provide feedback about a named trainer so that a particular trainer can be assessed with regards to feedback from all the trainees that they are supervising. The trainers use the sessions function of the app simply to record their clinical activities, so they have a pared down version. So for instance, they're not asked about the number of the number of assessments that they were offered or whether they received feedback. It's just simply a way for them to log their clinical activities for purposes of appraisal and revalidation. So if I show you an example of the one of the sessions forms on the smartphone, so the trainee is asked to say whether the session started on time or ending on time. That'd be further up here because this is scroll down. They can say this is a theatre session, so the number of minor cases that they performed, the number of major cases they performed, whether their surgical training was affected by a consultant decision or complications or time pressures, whether there was time to see the patients post-operatively, and as I said earlier, whether they felt undermined during the session. And if they say they're undermined, they're asked to say if they've reported it or not. And if they were undermined, they're asked to say whom by, not names, but was it a consultant, was it a registrar, was it a junior trainee, was it a midwife, was it a nurse, for example. And they're able to write a comment or a note for each session as well. If they say that they were undermined but they haven't reported it, then they're emailed a copy of the bullying and undermining policy for the trust to encourage them to report it if it's appropriate. It's a soft way of reporting undermining in a non-confrontational way, and if there's a particular pattern with undermining being reported in a particular session or about a particular trainer, then that could potentially be addressed by the training programme organisers. So we've talked about the session section of the menu. I'm going to talk briefly about the training section now. So the training section of the menu basically is only present on the trainer's version. The trainee is selected from a menu, and this is not anonymous, and it's completed after each session basically to provide feedback about the trainee's performance during the session, and it's effectively daily multi-source feedback because it will be done by a number of trainers about a trainee. So this is an example of a feedback form about a trainee in a theatre session. So it's a theatre session. You can say whether the trainee was punctual or not, whether the case mix was correct for them or not, whether work-based assessments were completed or not, and whether they were provided with any feedback or not. You can then rate them on these visual analog scales on a 5-point scale for things like empathy and respect, team working, verbal communication skills, insight, clinical judgment, and in this particular example, the operative skills for their stage of training. You can also write a comment as well. And this is very helpful because this provides daily multi-source feedback about the trainee for purposes of appraisal. So we can use the content management system that we have to look at the content of the smartphone app. So we can see a particular trainee, and we can see all the feedback entries that have been made about them, and we can see a summary which gives an average of their particular ratings on the different scales, and also gives a modal value as well. And you can compare that to other trainees in the department as well to see how the trainee is performing. The logbook section of the app is very useful. It's modifiable by specialty, so it's not just specific for obstetrics and gynecology. It can be changed for any other specialty, so it's very, very specific. It can be organised into different menus. The entries that you make in it are always time-stamped, and you're able to record the level of supervision you've had and any complications you've had for the procedure that you're performing. You can put mandatory items in this, for example, postgraduate medical education, things that are mandatory like induction and consent for procedures could be recorded in there, for example. And there's also an option to add a video link to items such as emergencies, so for example resuscitation, or in obstetrics and gynecology something like a postpartum hemorrhage. You can add a video link to a particular video about it to aid reflection, or it might be a link to a guideline or to a website to help reflection. This is an example of the logbook. So for example here they've selected labour ward skills and then fetal blood sampling. You could change this logbook so it's completely modifiable for any specialty, but it stamps the date and the time there. You can actually modify that if you need to. You can say whether you're independent or not. You can say whether you've had any complications, and you can write a comment. So it's very useful for appraisal and for revalidation as well. Finally, we're going to talk about the patient component of the app, which is actually going to be called surveys. Here you can collect patient and colleague feedback. You simply use the app to send an email out to a patient or a colleague with a link to the GMC approved feedback form, and feedback from patients or colleagues can then be collected and collated for purposes of appraisal and for revalidation. So you simply type in the patient's or colleague's name, an email address and a message to them. And essentially this is secure because obviously it's on a secure database, so there's no issues with confidentiality. The main take-home messages about the smartphone app are that it supports revalidation for trainers, it supports training for doctors in training, and it supports the ARCP and appraisal process for doctors in training as well. It supports revalidation for trainees by recording of daily activities and recording of practical procedures, and providing evidence of educational and clinical supervision on a daily basis. It's also a way of providing evidence through collecting patient and colleague feedback, which, as I've mentioned, is GMC approved. It also supports training because sessional feedback from trainees on their perceived value of the training is collected on a session-by-session basis. Patterns are able to be highlighted by this, and any issues that arise are able to be dealt with. It's also used for detection of undermining in particular sessions, and it's a way for the trainee to provide logs of their procedures and activities and support reflective practice through the videos and website links that I've mentioned. It also supports appraisal for trainees. The daily multi-source feedback, which is provided on the trainee by the trainer who's supervising them, will provide a huge wealth of information about their performance across the particular time period that you're looking at. There's a very useful content management system which can provide individual reports about this, and they have mean and modal values for each trainee versus the department to assess how the trainee is performing. You can see the number and type of each session that the trainee has attended, and you can see their logbook entries as well. So there's a very large amount of data about the trainee that would be easy to see and assess from the point of view of appraising them annually or monthly. So Healthcare Supervision Logbook supports revalidation for trainers. It allows trainers to provide sessional feedback about the performance of trainees. It allows trainees to assess their training session by session. It facilitates the annual review process for trainees, and it helps to promote a culture of high quality training and education. Thank you very much for listening. I'll be very happy to answer any questions that anybody has about this. Thank you very much.